All right. Okay. I'm a talking Santa potato again, and I'm here to talk about the what the Daniels down on what went down on the Daniel Smith show on December 23rd. The speaker the interviewee she had was Matt Strauss, MD, which is actually an upgrade from the political scientist she had on the other day to say lockdowns are bad. What's funny is, despite Danielle asking two politicians about treatment protocols, she asked the Premier of Alberta on November 30th and December 15th about treatment protocols. And then she also asked Aaron O'Toole, the leader of the Conservative Party, about treatment protocols on December 21st. And the treatment protocol she asked about was ivermectin for COVID. But then when she has this medical doctor on, what they talk about is not any therapeutic protocols. She doesn't ask him about ivermectin once. She doesn't even ask him about the hydroxychloroquine she's been pushing all year. She doesn't ask about anything like that. She doesn't ask about prophylaxis protocols or anything like that. She has him on to talk about how lockdowns are bad. Let's just right off the top, was the same criticism I've had for other videos where lockdown is not really defined. But let's just get into it, and then we can talk about why she's not talking about therapeutic protocols anymore.
Well, let's talk about this other aspect to it, because the impression that I'm getting, especially when I see the massive outbreaks in hospitals, in correctional facilities, in long-term care facilities, the impression I'm getting is that, just reading between the lines from what our Dr. Dina Hinshaw, our medical officer, says, it's almost like we've got to lock everyone down in case someone inadvertently transmits COVID to someone who then goes into a long-term care facility, whether it's a visitor or whether it's a staff member. Therefore, because community spread is so wide, we've got to keep everyone locked down so that we can keep it out of the facilities where we've got congregate settings. It does seem to me to be a bit of a problem with that logic. I can't put my finger on it, but maybe you can.
I think it's making perfect the enemy of the good. So in a perfect situation where we had zero COVID, where no one was seeing anyone and no one was going to work and we were all staying at home, then we could get zero transmission, and then you could go to a nursing home once everything had died out. But that has never been possible. It's cost too much in terms of mental health, in terms of suicide, in terms of job loss. So we've been aiming for that, decreased community spread. We have not achieved it, and we could have taken all of that effort. We're going $450 billion into debt fighting this pandemic as haphazardly as we have. $450 billion plus our time and our attention in saying we could have been screening. There could have been tests at the entrance to every nursing home in Canada with $450 billion. Instant tests. Instead, we've been testing snotty-nosed 3-year-olds. So I understand the concern, but I think the scale of how much harm we've caused in pretending that it's impossible to protect people in nursing homes. I mean, we've protected the NHL. It's possible. We've shown that it's possible. So I guess I hear you. I just don't buy that line of reasoning.
Got it.
So again, this is Matt Strauss saying, lockdowns, like the cost is too great. There's been too many suicides. At-home stimulus money could have paid for testing in senior care. That would have been adequate. I don't know how define adequate. But and then he says, we protected the NHL. So let's just get into this and what this means. First, I don't like to click on this constantly, but the suicide death rates continue to look not as bad as everyone expected or everyone keeps on saying they are, right? So there hasn't been an increase of suicides. I don't know what he's talking about. He doesn't seem to, actually cite any numbers. So his idea of there's a mental health epidemic caused by a lockdown, we're not seeing it. Additionally, what he says about, we we protected the NHL, right? And it's true. It's like no NHL players have tested positive for COVID-19 since entering the bubbles, right? But he doesn't get into what's a bubble, right? And then he says, so let's read more about how the NHL did that, right? You know, right? So they had bubbles in hub zones in Toronto and Edmonton, right? And then they had testing and testing and testing, and then they planned it, and then if they went to how they picked Canada, and they picked Canada because the community spread was low, which is interesting because Matt Strauss is kind of advocating to ignore it. Then the other things. So the weird thing is they basically separate them from families until the conference finals, right? Because the number of people in each bubble initially was very large, but then at the end when there's so many less, because people during the playoffs and whatnot, teams drop out, then the families are allowed to visit, right? So basically, you take a bunch of people and you send them to Toronto, Edmonton, and then you lock them down, and then you test them every day, all day, and then you say they can't talk to their families. I guess we could do this for all the people in long-term care homes across Canada and the United States. I'm not sure what he's meaning, right? So this is the extent that they went to quote unquote protect the NHL, right? So if he's advocating this for long-term care homes, basically what he's saying is, let's, remove a bunch of people from their families, collect them in one place, and then monitor them intensely. It's basically imprisoning people. So that's how we quote unquote protected the NHL. And then if you look, we kind of like went down this road and we decided let's do this again for the World Juniors, right? And we all know how that went. A bunch of people tested positive in the bubble, right? So you could say the people weren't in the bubble, they came to the bubble. What's funny is they're trying to set up another bubble. It didn't work, right? So the idea that the solution's reproducible and effective is kind of ridiculous. So let's just keep on going here and then get to all those other things that he's going to bring up. Because the obvious question is, what about Australia and New Zealand, right? And Danielle Smith thinks about this, and because she wants talking points to hit people with. So let's just see what he says.
Well, someone does say, though, and I get this all the time, well, what about New Zealand? What about Australia? They lock people down for months, and look at now. Now their lives are essentially back to normal because they got to zero. That's what we should be doing.
Yeah, so there's a few things. One is, I think it's now clear, even though it was widely derided back in the spring, it's now clear that there's some amount of seasonality to COVID-19 transmission. New Zealand is technically a tropical country. In fact, it's a tropical island. Australia is also a much warmer climate than ours, and it is also an island. It doesn't border any other nation. So I think there are things that tropical islands are able to achieve that a country with the longest undefended border in the world with the United States is simply not going to be able to achieve. So again, we need to not make perfect the enemy of the good. The other thing I would say is Australia had these extremely harsh, almost totalitarian lockdowns where they were entering people's homes and arresting them for their Facebook posts. They didn't get to zero COVID. Some of the states are locking down again because it's still on the move. So I'm not sure that they've actually purchased so much normal life for themselves. And the other thing I will say is there are other islands in the Pacific, like Taiwan and Japan, who have also done extremely well without resorting to lockdown.
So his claims, let's get into this, right? His claims about Canada, Australia, New Zealand, right? He's saying New Zealand is a tropical country. Later on in the show, he retracts this because it's such a ridiculous statement. I don't know how many Lord of the Rings movies need to be filmed in New Zealand before people realize it's not a tropical country. and then he says Australia is an island, right? Because it's only one country, I guess. I didn't follow his reasoning there, but it is a gigantic landmass with 24 million people on it. Someone would say it's continent, right? But he thinks it's an island. Islands different, right? And then he says that Canada cannot keep COVID coming across the closed border of the United States. This might be his best argument, but let's get to that. And then he says Australia didn't get to zero COVID, and he says Japan and Taiwan did extremely well without resorting to lockdown, right? So let's get into this. Did Australia get to zero COVID? Well, Australia posts updates like everyone else does. And then his daily update from December 22nd, active cases in the whole country, right? It's not new cases today. This is active cases, 146. Locally acquired in a country of 24 million is 8. Overseas acquired in the last 24 hours is 11, right? So their community spread is basically 0, right? Overseas acquired last 7 days, 76. Locally acquired last 7 days, 103, right? So what they're getting from planes from other countries like Canada, like United States, like whatever, is basically at parity with what they're transferring locally, right? So if they just do the quarantine right from the traveler's perspective, then the rest of the country is a bubble, right? Just like the NHL. It's an NHL team with 24 million people in it. It works. But let's just go to this, right? So he says Australia didn't reach 0, right? And then, the 1st of November, it's on the BBC. I don't know how it keeps on arguing this point, but it says Australia records 0 COVID-19 cases for the first time in 5 months, right? So 5 months, right? And the lockdown was a long time, right? And and it was different for other different areas, but eventually, they're at a similar spot now, right? The country's at 0 local transmitted cases across the entire country, right? So I think the state of Victoria had the hardest lockdown, but these photos are from Melbourne. But they got to 0 transmission, community spread. So for him to say otherwise is ridiculous, or suggest otherwise at least. And then he's saying, Taiwan and Japan did great, right? And then this article saying Taiwan led the world in closing for COVID-19, right? So what he's saying is Taiwan. I don't know. I should get an ad blocker, but this is saying that Taiwan was one of the first countries to block flights from China, right? So they're saying, Taiwan didn't do a lockdown. They just summarily blocked flights, right, and did all these other things, right? And then they said this other interesting article, right? This other interesting article gets into all the digital basically the digital quarantine systems, right? Here you go. Taiwan leveraged technology to build an effective digital quarantine system. Those returning to Taiwan from overseas are sent to a quarantine hotel. And then you're tracked. It's okay. Then they're saying there's some ways that they're tracking you without knowing precisely where you are. And then they're also talking about how it was already common to wear masks, right? So this is another thing that Danielle Smith's been complaining about for months. So with masking and digital weaponry, maybe Canada could do something similar. But Matt Strauss and Danielle Smith can talk about how provinces across Canada have failed in contact tracing. We don't know who's using that federal app. We don't know who's using the provincial app. I think that Alberta decided to create their own app. And it's just been pathetic, right? So but pretend that we're doing something else right, and we don't need to do this lockdown. And then I'm going to hit a paywall here, but this Financial Times article talks about how Japanese businesses have been locking down voluntarily instead of compulsory, right? So you can say, oh, Japan didn't do a lockdown. It's just that businesses chose to close. This distinction is completely stupid. And then same thing with this article here, how the Japan's mask culture may have saved lives during the coronavirus, right? So you have a bunch of people that, masks were second nature, right? It's already to some extent a custom. Yeah, but all of that is glossed over, and it just becomes Japan didn't do a lockdown, Taiwan didn't do a lockdown. Well, everything closed and the flights were shut down, but we can say that they didn't lock down. And then you can gloss over what Australia did, right? But let's dive into this thing, right? This one point here, right? Where Canada cannot keep COVID coming across a closed border with the United States, and Canada's not an island. So let's just piece that together, right? So here's Canada generally, right? So in terms of where the islands are, right? So let's get this pen a little thicker. This part's an island, and on this island there's COVID because Canada screwed up, right? And then on this island, this is an island, and like this island there's COVID because Canada screwed up. And then all of these are islands as well. And then here's an island, here's this, here's like the Maritimes or whatever. And then, and then here's an island. But the interesting thing here is there's no COVID here or no COVID deaths right now. And there's very little COVID here, right? Is Nova Scotia also an island? Oh, I guess PEI is an island, right? So there's no COVID. We can do no COVID here, and here, I guess, right? But we can't do it anywhere else. Oh, then again, we close this whole undefended border, or whatever Matt said. This border is currently closed to non-essential travel, right? And there's 107. I think last time I checked, there's 117 checkpoints, right? 117, right? So we can't keep track of 117 checkpoints. Let's move that back into the screen. So there's 117 checkpoints across the southern border. But there's no way we can do this. Also, like between provinces, there's like a handful of roads, like you can count them on one hand. But we can't meaningfully lock down. We can't do a staged lockdown like Australia did, and we can't pull it off because reasons, right? There's no way we can keep COVID out of Nunavut. There's no way we can keep COVID out of Newfoundland. There's no way we can keep COVID out of Vancouver Island. There's just no point. That's essentially his argument, right? But let's go down to what he thinks that we should be doing, right? So let's get into what he thinks we should be doing.
So I don't think so. For most of my training and most of my career, most of the ICUs in the regions that I've worked in have been full most of the time. Like the hospitals I work in are 102% full on a good day. So we need to start taking seriously what universal healthcare means and what we have to put into the system in order to have a safe system with some buffer space for when something like this happens. I think that if I was in charge today, or better yet, 9 months ago, I would have appealed to the work ethic and courage and civic mindedness of young, healthy people. And I would have said, we've got a big problem. We need to do a lot of, like, $450 billion that we've gone into debt could have built not one, but 2 new hospitals in every city and town across Canada. So instead of having healthy people hide in their basements, we should have had them all out building new hospitals, building new nursing homes, learning how to use PPE so they could get into these facilities and start volunteering and feeding these, extremely unfortunate elderly women who have come across who are starving. So
So yeah, let's get into this. Like, so it's like, oh, the for $450 billion, Canada could have built all these hospitals, and if you go through the numbers, it's not actually as insane, right? But the thing about this $450 a deficit, it's a deficit. It's not. It's not necessarily additional spending, right? So if oil and gas revenue, for example, dries up, if there's no economic activity in like stadiums, hotels, tourism falls flat, you're going to run a deficit at the federal and provincial levels, or spending drops, right? You're going to run a deficit irrespective of additional spending. So what is he actually talking about, right? So there's nothing you can. It's not like there's $450 billion of additional investment. So let's just piece together like the CERB or whatever was $81 billion, right? To 8.9 million people, right? And then, so the alternative COVID plan is, you still need to close stadiums, office parks, and theaters, etc., right? Because the way COVID works is like you're still going to get outbreaks in these very large gatherings, so like weddings and stuff like that is completely off, right? So you still need to pay employment insurance to all these people, like $81 billion. But you could get them to build hospitals and pretend to be doctors. And if you work through the numbers of new hospital builds, you kind of like get to thinking, okay, you get to, if you run all these numbers, and I kind of almost tried to, you get to the point where a new hospital bed is like to build is about $2 million, and then operation, let's just assume is $2,000 a day, is about $730,000 to run a year, right? So if the Canada Emergency Response Benefit pays out right now it's paid out $80 billion, right? So ignoring the deficit point because it's silly. Let's say the CERB pays out 120 billion. You could actually get 60 new beds constructed, or you could get 160K new beds could be operated, right? And then compared to what Canada already has is 50K hospital beds plus 30K in Quebec. It's or 60K plus 30K, that's 90K, and then you get 160K more for $100 billion. Okay, great. But if any of these, if this math is sort of correct, then it sounds plausible, right? But here's the crazy part, right? So the deficit drop, the deficit drop here, right, is not additional spending, right? The deficit drop is not additional spending, right? So different sectors of the economy roll up because of a pandemic, right? Your customers are staying home voluntarily. Then you're going to have revenue problem, right? And this is not going to be money in the productivity that the federal government could spend. And then also all the CERB recipients are not magically builders and doctors, right? Just because you send people payouts, it doesn't mean they can build a hospital or be a long-term care nurse, right? This is not something that people do, right? They were working at a theater or in a cubicle, and now they're at home, and then they need supplementary income because they are not providing a service, right? It doesn't mean that they can go out, get a plastic shield on their face, and then feed the elderly or whatever. And then the COVID-related costs do not map accurately, right? Current healthcare construction is not COVID-ready, obviously. That's what we've seen, right? So we've seen that these hospitals that, I've quoted here, these $400 billion hospitals, $400 million hospitals, they're not really ready to take a whole bunch more COVID patients, right? So let's say we build a COVID-aware hospital. What would the expenses be? We don't really know, right? All the things that we might need for the next, SARS outbreak. And then also, it would be completely absurd to just accept a doubling in healthcare costs due to COVID on top of existing healthcare expenses, right? So you have all the people in long-term care with long-term care needs, and then just say, oh, we're going to have all these expenses plus, we have all these respiratory issues caused by coronavirus. It's kind of weird because to even have this discussion because of especially now with the vaccine. The idea that we just let it rip. Yeah. So the other silly lies that Matt says on Twitter, right? So he says, Florida rescinded all COVID restrictions, right? And then he's like implying that nothing bad happened, right? So, maybe the Miami Dolphins are playing in the stadium again. I don't know what he means about all COVID restrictions, right? So this is kind of a ridiculous statement to make. And then he's like, behold the utter absence of a COVID apocalypse, right? So he's tweeting this like November 23rd. I believe American Thanksgiving was the 27th or something this year. So let's just see how that worked out by actually going to the New York Times and looking how the Florida data looked after the 23rd, right? So he's tweeting this on the 23rd. And here's the 23rd, right? So he's saying they rescinded all the restrictions on the 23rd, and then, Thanksgiving happens. And then, here's your case rates, right? New cases. So he's on this he's on this 7-day rolling average up incline, and then he's in November, and he's got a chart of deaths, right? So his death chart does not capture this case rate, right? So let's just go down to how deaths have panned out after he tweeted that. Yeah, right. So he is in November 21. November 23rd. So November 23rd, the 7-day average was 75, right? And he's like, oh, the COVID apocalypse. It looks like this chart's going down. He's ignoring this chart that's going up. And then since we know death's a lagging indicator, we're back at, 100 deaths a day, 96 deaths a day. Definitely not the highs of the summer, right? And then he's saying Australia's tropical, so this is Florida in August, right? At 148 deaths a day, or 7-day average of 181. So it kind of undermines this whole point about kind of what Australia should be seeing, right? So Australia should be comparable to Florida potentially. But he doesn't bother to look at any data except the death chart, and he doesn't look at case rates, and then he doesn't follow up at the end, right? So then let's go look to another thing he tweeted, where he said, CTV News has reported that out of so many cases, 98% were COVID deaths. 98% were in long-term care homes. Right? And he says canceling children's hockey and shutting down small businesses is not the answer. Directing massive resources into long-term care is the answer. Right? The funny thing is, later on he tweets this. This CBC reporter that he's quoting has pretty convincingly shown that the CTV report is an error, right? So all other reporting on this is saying about, I think it was like 80%. I saw one search which said 80% of deaths is in long-term care homes, which is like still a majority, but it's the difference between 80% and 98.4% is quite a big deal, right? But then he's saying, okay, this is completely bunk, right? So the report is an error. But he's saying his follow-up tweets about the nursing homes, right? That all these things that he's saying is still true, right? So then the next thing he's saying is South Dakotans are running around without masks, right? So he says North Dakota resisted business restrictions. I'll just open up this thread. So and then he's saying, okay. So the first tweet, he says, North Dakota resisted business restrictions and mask mandates until November 13th when Governor Burgum succumbed to political pressure, instituted both, right? And they say cases fell right after clear evidence that policies worked, right? Wrong. South Dakota instituted neither, and an almost identical pandemic curve is visible. Remember, if there's no control group, it isn't science. And just in passing, it would be hard to find a more equally matched pair of jurisdictions in compared to North and South Dakota, right? So let's go into what's happening in North and South Dakota, right? So here's the tweets, right? And then the funny thing is Sioux Falls, right, approved a mask mandate, right? And Sioux Falls, the wild thing is, like 20% of the population of the state lives in Sioux Falls. Now, the mandate didn't have any penalties, right? But you get compliance, right? So this mandate was approved November 18th, right? The date he's going for is November 13th in North Dakota, right? So North Dakota, November 13th comes in. He's saying South Dakota didn't do anything. Well, Sioux Falls, November 18th, passed a mask mandate as well. And then later on, they extended the mask mandate to I need to get an ad blocker. They extended the mask mandate to March 13th, right? As far as I know, there's still no penalties, right? But here you go. Here's pictures of people in Sioux Falls, South Dakota, wearing masks. Now, it's true that the governor is not doing enough or not doing much of anything, but and thinks it's all fake. But here we have voluntary compliance, right? We have enough voluntary compliance that the result is the same. So Matt is correct when he says, if remembers of no control group, it isn't science. So this could be evidence that mask mandates, like the penalties in mask mandates, don't really do much, right? You could say, oh, we're going to throw you in prison if you don't wear a mask. Maybe that part doesn't do anything. But the thing is, if you get compliance, no matter how you get it, whether you scare people but with a penalty or you just pass a mandate that doesn't have a penalty because people don't know what the actual penalty is, they just assume there is one, then you're going to get a lot of compliance just by putting the sticker on the door and saying Sioux Falls to South Dakota requires masks indoors. And this is kind of the end of it, right? So it's like, here's a choice, right? Created by Matt Strauss, right? Instead of an early designed intentional lockdown planned by government, right, like Australia did, right, a methodical one, he's saying build out healthcare capacity and create a voluntary lockdown by people wishing to not be captured by the vast healthcare system, right? So he's saying, we can't control all of this, right? These are, there's a bunch of islands, but we don't know what's going on. We can't control all of this. So let's just build a bunch of hospitals, and and tell people to go about their daily lives. And when they don't, because they won't, no one's going to go to a concert just because you told them that you built another hospital. Like this is complete and utter garbage. Like his reading and his reading of data is not how he's reading Florida data, how he's reading South Dakota data, and how he's reading Canada data is completely absurd. And he's just said with no evidence, he's misrepresented Australia, he's misrepresented South Dakota, he's misrepresented Canada, he's misrepresented Florida. It's just completely absurd, right? But he's saying, Atlantic Canada, if you remember, right? These guys, right? these guys figured it out, right? They had, I think last time their weekly death rate across these provinces was 0, right? So why are these provinces, or all of these provinces, not figuring it out? What's going on? What's going on here? You say, oh, you know, these places aren't islands. Well, New Brunswick's not an island. Australia's not an island. Yeah, it seems quite clear that people are going to stay home. Now, you could either have a government that does something and in a logical and sane way that Australia and New Zealand seem to have done, or you could just have a government that stumbles through it, which seems to be Canada with how the federal government and province are operating, where a province will decide to act unilaterally and then nothing really changes because Canada's one big pool. If somebody pees in it, then you can't get anything done. So, yeah, I think if you just look at the numbers, Australia wins, Atlantic Canada wins, and New Zealand wins. And the rest of us are just losing, failing very slowly. All right.